Here we have two public health experts who have dedicated their lives to quietly saving lives at scale. And I have been extremely inspired by the work you have done over the years. I don't want to do a poor job at explaining your background and your roles, Dr. Prabhdeep and Dr. Ganesh. So I'll pass it on to you to introduce yourselves. Tell us about the work you have done. Both of you bring about 2 decades of experience in public health, and would love for you to tell us why you're here as well. Thank you.
Like me to go first? Hi, everyone. Thank you for joining us. I'm Prabhdeep, joining from Bangalore. I'm basically a physician and an epidemiologist. And one thing I was never trained for is technology. And I often tell this, that we didn't foresee that that will become sort of so important for public health. And that's why I'm here, because over the last 20 years that I have been in public health, I have seen how technology has become an integral part of many, many things that we do. I have worked in various type of public health projects around chronic disease, hypertension, diabetes, screening of cancers, and infectious disease preparedness, COVID pandemic, and so on. So happy to be with all of you.
Hello, everyone. My name is Ganeshkumar. I work as a scientist at the Indian Council of Medical Research. Mainly, I work with the health systems, mostly on public sector. Majority of my projects I've been working is focusing to bring a lot of interventions into the public health in order to find certain solutions for the complex public health problems. My most important area of interest, which I get aligned very well with Daniel and Mahima in our current work, is about the on digital health, and where I am trying to use technology mainly into the public health problems. But I carry with a great, like a journey of seeing a lot of failures than successes on usage of technology on public health. So I'd like to have a great chat with all of you.
Fantastic. It's great to have you. I think just to kick things off, maybe if you can set the stage by telling us how public health problems are different from private ones. And for context, the reason I'm saying this is that a lot of the people who are joining us today in our audience might be designing for private tech sectors, maybe in healthcare, but we know that this problem is definitely more complex and hard. So just to set the stage around that.
You want me to go first? Okay. Yeah. So definitely, I think public health is about public. That's what the word public health, right, comes from. So it's about people. It's about communities. It's about problems that are they may look trivial, but these are the problems that are faced by millions and billions of people, hence making them complex. So the problems from outside may look small, but when the small problem is there for a million people, it's no more a small problem. So what happens is the scale is very different when you deal with something. So whenever you are trying to think of a solution, it's not a solution you think of hundred and thousands or 100,000s. You have to always think about scale and impact and reach. And most importantly, when we conceptualize problems in public health, we need to keep in mind the inequities, both in terms of socioeconomic, geographic, and even in terms of the access that people have to various not just what I mean by access is not just access to hospitals, but access to everything that makes us healthy, right? Which is much broader. And the reason why problems in public health are complex are because to find a solution that works for such diverse people or a diverse set of scenarios is very, very hard. And somehow tech is always so tailored and when the problems are well defined, I think it's easy for the tech to just fit in. But that's not the kind of situations we often face. Over.
So, just to add up on what Dr. Prabhdeep has mentioned, public health majority handled by this public sector when compared to a private sector. Public sector is very complex and integrated, whereas private sector is more of controlled environment. But in public sector, it's not like that. Majority of the public health interventions, be it is vaccine, be it is in terms of mass drug, and be in terms of large public health program. One thing which I always like, I borrow the word what Prabdeep has mentioned is about the scale. Is what public health could do that, and majority is being handled by the public sector, otherwise called as government organizations. There, it's very complex because it's not the same stream of people. Like an example, like technologists working on, say, like one product. Everyone at least have a kind of a common understanding into it. But however, at least a kind of like a basic fundamental knowledge on that. But here, in terms of public health, it's entirely different. You have a technical person, you have a medical person, you have a sociologist, you have people, you have an administrator. All above that, like then you have entirely a different type of like say like bureaucrats. So all these things brings the complexity, and when necessarily that comes to scale, it holds good. So that's how the reality that we have to accept it, and we can't expect like always public health is a box of chocolates. It comes with a kind of a mix.
Yeah.
Over.
Yeah. So my first experience with public health was talking to Dr. Tom Frieden, who you both know well, and was the former director of the Centers for Disease Control, and worked on the DOTS program in tuberculosis in India. When he first talked to me, I was working at Google at the time, and he talked to me. He's like, "We're going to work at scale, because we work in India and China." And I'm like, "Whoa, that's like a third of the Earth's population just in 2 countries." And that's exciting for technologists because we're like, working at big scale is tech's very good at this. On the other hand, I was very aware that there's just as you said, Dr. Ganesh, there's a lot of bureaucracy, and some bureaucracies, like I live in the UK, are infamous for being slow and convoluted. What's your experience in, deploying programs at scale? Is it slow and cumbersome, or is it at the speed of technology, where you can just deploy something to the cloud and go big? Like, where does the balance fall?
By means of its design, in terms of its complexity, it has to be slow. Anything whichever happens in the world in scale always happens with slow. And some of the time, even I was very impatient on in my initial part of my career and seeing that why things are not happening fast. And this could be done like an overnight or in, say like in a fortnight. But apparently anything that happens never sustains over a time. So I think that like not to have a right reason, but probably by its design that public health itself should be slow so that it gains the momentum and it goes with a scale. So that's what I think. That I don't see that as an uh, a disadvantage. I see that it is a design problem. I did not design problem. It's a design characteristics of the public health. When I say design, like you have a different notion, but I my notion here is that like that's why the complex design, the different type of people, the different types of characteristics makes it to go slow. That's why I think maybe
Yeah.
Prabdeep can add up on certain thing.
I agree with Ganesh. See, I think you are. So the thing is that here you're not just trying to deploy a product, you're trying to change a system. So I think as designers, you understand the system concept much better. So your product is fitting into something, but for that to fit in, many other things have to change or maybe modify or maybe accept that change. I mean, it's not, there is always a human side, which, it's there for all technology, but in health, it's only more complex because you have to get acceptance of people to use whatever this new innovation you are trying to put it in. But, there's another side to it. There's a positive twist to it. it's like it's very hard to put an innovation into the system, but it's also very hard to get it out, right? So the good side is once it is in, it stays, because the system gets tuned to this change. And then if you try to change, it's like it's very hard. I remember my early years as a public health professional, and a very senior colleague of mine I was working with, I was very disappointed. I was working on an intervention, not a tech intervention, but an intervention, some system level intervention. And I was like, oh my God, it's just so much effort. And then he told me this, you just have to stay put. Once you put it in, it will stay. Even if you want to get it out, it will not come, it will not change. So I think, yeah, system level changes take time, and but it's gratifying because when you bring that change, it's very sustainable and it works at scale. So there is a negative side of it, there's a positive side, but yes, you have to be in for a long game. You can't, I think the tech cycles are very short, like people do very quick cycles. So I think that's fundamentally what doesn't work in public health.
Dr. Prabdeep, you and Dr. Ganesh, you say that that it has to be slow, but my experience in the early days of Simple was that we spoke of pilots within the team, but the pilot was in 3 districts, for instance, right? And for us, that's not slow. That's so it's for me. I always felt like public health moved really fast because for us, a pilot would be, say, maybe one facility, or we'll try to go from like 0 to 5 users. But the scale of public health and how quickly we deploy solutions, I think, yeah, when you say slow, to me, it still feels like it does move quite fast. There are decisions that are made and deployed immediately.
No, I agree with you, Mahima. I think what we meant by slow is that, like, for us, 3 district is very small. So so it's just that we feel that, let's say, if I want to, for any intervention, right, if you want to sort of do it at scale, uh, it just takes several years to reach the kind of scale we would like to reach as public health professionals.
Yeah.
I think that's where the difference is. Whereas I think if you're doing tech in the private sector, you're defining very clearly who is your audience and who are your users, and then you are looking at the uptake within that. So that's where the difference comes.
Yeah. So you're already getting into this a little bit. About the difference between kind of the role of technologists in public health, the idea of thinking long term, for instance, and not necessarily expecting quick wins. What makes great public health technology? Like, what is the role of technology in public health, in your opinion?
Okay, right. See, the one thing per se, when it comes to digital technologies, WHO has 6 pillars of the health system, and one of the pillar itself is an health information system. And when it comes to the health system into public health interventions, naturally there are something called technology level intervention at different level. Technology doesn't mean only digital health. Technology involves diagnostics. Technology involves newer vaccines. Technology involves therapeutic devices, medical devices, many other things comes into the role of that. The necessary part of the biggest game where the technologist plays a role in public health is that how to make this work in a hard setting. That comes, I believe so. Technology has to play a major role. For example, you need to use a technology where there is no internet, a digital technology, but where there is no internet. You need to use diagnostics where there is no electricity. You need to use a medical device which doesn't require a lot of expertise. Should be easy to use device. It should be easy to diagnose it. Rather than a routine, the world what thinks as a technology, a complex instrument and complex kind of like a program. But per se, in terms of its usage, technologies have a greater role in order to bring this simplicity, usability. I'm just trying to get this done in a non-low resource setting. I believe that technologies has a greater role into that. The mainstream public health person or a person who is working into that devices into the mainstream may not bring that particular flavor. And I truly believe that that's where I could see that a lot of promising the institutes where Dr. Prabhdeep belongs is coming up with point of care diagnostics, which doesn't require an electricity. Those things matters a lot. Yeah, Prabhdeep, over to you.
Yeah, I think, first of all, I want to say that I think now we live in a time where technologies are integral part of every public health intervention we do and every public health system. I think since there are mixed audience here, I just wanted to tell you all that most public health departments or health departments now have a tech team, a dedicated tech team. Although these tech teams may not be as big or as advanced as it is in the private sector, but what it tells you is that it's given, it's going to be there. Tech is here to stay, right? So the challenge we face is that a lot of tech that is passed on to public health wasn't initially built for public health because it was built thinking something else. And I'll give you my initial experience. I think of the 20 years that I have been in public health, I think the somewhere around 2006-7 onwards is when the electronic health records actually started coming into the public sector. Those were the very early days. And most of the solutions which came into public health actually came from private sector. They were developed for hospitals and so on. So this was actually my first sort of interface with the tech. And I realized that those who developed had actually never gone to the places where these solutions were to be deployed. And when they started deploying and the kind of problems they came up with, they had never thought of things like, you are sitting in a nice fancy office, but then you're putting a tech there and there is suddenly no power for 5 hours and things like that. So those are very basic issues, but I think also understanding who your user is going to be and what are they going to do with it. So that's where the whole problem starts. So I think we have to accept that technology is here to stay, but more and more we would like more and more technologists to be part of the solutions right from the beginning, like starting from conceptualizing the problem. And I'm sure like there are people who have great ideas and they'll come up with great solutions, but it could be that they did not have the chance to really look at it from that perspective. So I think the one word I would say to all the technologists is that be co-design your technologies no matter what it is.
Yeah.
Over.
Can you give us some examples of people who are doing it right? There's a lot of public health technology that fails. Like, who's doing a good job with this?
Yeah, I think there are examples of successful use of technologies in public health. Of course, we all worked together in the Simple when it was developed, and I think it was right from the conceptualization of idea. We all
I meant
worked together.
other than Simple. We don't have to just
Yeah,
promote the
I'm just
product we worked
starting.
on.
Exactly. But there are other, for example, if you take COVID, COVID was a big success. I think those of you who might not be aware, it was a great digital platform which was developed very rapidly and it was used for vaccination, COVID vaccination. And people could download their, we all needed these COVID certificates for travel, for every kind of thing. It was very easy to use and people could register, get them vaccinated. So this is one example I can think of. And why I mentioned this example is this was also done under a lot of pressure in the times when there was a crisis and there was pandemic. We have also been part of other tech solutions, like maybe Ganesh can talk. We work with the governments to support simple technology solutions for COVID, where they could easily map where the caseload is more, so they could focus their efforts on that and so on. So yeah, there are several success stories. Yeah.
Yeah.
Dr. So Dr. Prabhdeep, just to step in for a second. So with this suggestion you had around co-design, I think we all likely have a different image in our mind around what successful co-design might look like, kind of with technologists. So I was just wondering from your experience, if you can kind of describe in detail, what has successful co-design looked like, felt like.
Yeah, Ganesh would like to. Go for it.
Since the COVID example was brought in, I will tell my personal experience, two different things. One, there is one platform developed by a government locally. Um, During the development, they involved the users who are all the frontline healthcare workers, and they also involved the managers who is going to look into the data in order to take decisions, and they involved their own team's technologists. This is one thing. It's a sprint mode. I mean, I'm borrowing that particular term, but why I'm saying sprint? Within a week, it was developed and it was deployed. This was happened when COVID was in full fledged, and everyone was involved in a very short period of time. They had great focus and they did it. Another example I will say, the popular tools which are already available. We are all talking about the digital health technologies for maintaining the data and communication of it. The most popular tools which have been used are Google Sheets, and the other thing is WhatsApp for communication, and the third is that Google Meet for talking to each other during the meetings. All majority, wherever I would see that it will be a Google Meet link, everyone will started using it. Now, this is what I could see, that these kind of technologies which has been used and repurposed for many other purposes, and you never know that how it made their life much easier. Anytime they can share that data, or they can share the communication, or in terms of share that and immediately linking everyone to a common action, all these kind of tools had helped. I mean, in hard times, I'm saying to say that. And in peace times, to be very frank, it is pretty slow in terms of adopting it.
Yeah, I agree. And I want to just mention that, WhatsApp is a perfect example. Actually, if you ask me, the digital tool which is most used in the health is WhatsApp. And it's
Why is that, Dr.
extensively used
Prabdeep?
in India
Can
by doctors, by nurses, by for all kinds. And in the lot of communication and the groups. I mean, there's just many ways people use WhatsApp. But people just use. No one asked people to use WhatsApp. Like we had emails, we had so many other tools. But why people use WhatsApp? It wasn't developed for health, but I think it's the most commonly used tool.
And doesn't require any training. No one needs to training on how to use WhatsApp.
Mm-hmm.
Yeah, 50% of Indian health probably runs on Excel and WhatsApp. Yeah, powerful tools.
That is true. I have a question. So I've seen this as well in practice, Dr. Prabdeep, where is my internet wonky? Can you hear me? No.
No,
Yeah,
okay.
you're good.
Yeah. Okay, awesome. I was saying that I've seen this in practice as well, where WhatsApp is even in the most remote areas, the app of choice. And so I was trying to understand what are some of the things that they're doing well that one can keep in mind while designing technology for public health, and along those lines, what is a cheat sheet that you would give a technologist who's newly entering into public health, right? Like, here are the top 5 things why maybe, let's say, a WhatsApp works, but if you're designing a new technology, what do you need to kind of keep at the top of your mind? Yeah.
Shall I? Two things I would say, more than a cheat sheet, it is observation and conversation. So, who are the users? Go sit and observe them, how they are handling or where the technology is trying to fit in. Conversation, converse to those people who actually going to use it and who is going to influence the usage of that technology. Talk to them. This is too important. More than a cheat sheet, I would say these are the preliminary things that any technologist should do in order to understand it. Dr. Prabdeep?
Yeah, completely agree. I think maybe it's got to do with our original backgrounds and the training styles. See, most of the people who are on the tech side come from the engineering background, and I think when you are working, maybe I don't know how it is to be in those kind of work environments, but there is no constant need to possibly adapt what you're doing to the requirements of many stakeholders. So I think the fundamental problem with the public health solutions is that there are too many stakeholders, and there is constant need to adapt to them. So really talking to people is very important. Understanding their needs is important. But then within that, again, prioritizing, right? So I feel one of the challenge which tech people face when they are open to talking, they actually do go meet, they meet various
Never.
stakeholders. I have seen many of them. Then what happens is everybody gives a different requirement.
It's a
Okay.
samba.
I think you need to silent somebody. Yeah. So everyone gives a different requirement, and then they get confused. They're like, okay, nurse wants this, doctor wants that, the manager wants something else. So that is where the problem begins. And then they just find it extremely difficult to kind of narrow down like whose perspectives are more important, right? So that becomes extremely challenging. So I think understanding eventually who is going to be the user, and sometimes, not sometimes, most of the times, users may be the most silent ones, and they may be the one who will not openly sort of say what their needs are. Especially the large programs are run by community volunteers, community health workers, nurses, and we end of the day are not so much used to um, sort of taking opinions from people who are more working on the ground. So quite often you may get inputs from people who are likely to be in the boardrooms, but making sure that you're also listening to those who are not in the boardrooms is really important. And I think one of the other key lessons we have learned is also the whole internet thing, right? I think somehow it just seems so counterintuitive to people in tech that we say that no, we have to use this tool, but there will be no internet. I think most people work in tech offices where there is no internet interruption, and that is a really big thing. So I think the two, why WhatsApp works, it works offline, right? You can type your message, it goes when you connect. So offline first, I feel is really important. And also public health tools need to be very simple. And you need to think that diverse literacy level and diverse educational background need to be kept in mind while designing these tools. I think those are really the crux of it. Thank you.
Really like the question in the chat. Thomas Davies says he thinks when we talk about technologists, we should be clear about the skill sets needed. It's not just engineers, it's people like designers and user research. What's the mix of skills that you see on teams that succeed?
Are you asking the mix of skills for a technologist?
Yeah.
Okay, right, fine. So, lot of soft skills on patients. When I'm talking about technology in public health, that's really important. And second is that, like, in terms of try to observe even a smaller piece of it, document the observations in a way that how it is influencing the usage of an app. And third is that, like, try to converse to a lot of people and with lot of scenarios. The one thing a technologist always should pursue is that, like, totally taking away from their shoes and putting themselves on the other shoes, and seeing that, like, if this is going to be used for a particular purpose, whether that particular purpose is going to get attained or not. This itself is the most important thing, I would say. Like, majority of the time I see that, like, a technology solutions were made keeping themselves in them, because I like it, so I develop this. I like it, so I design it. So even I'll give one example during COVID. COVID I will take because COVID actually accelerated the technology usage in public health. So after post-COVID, if you see that in health systems, in public health, in government organizations, the usage of technology has accelerated, and people started using, and they get introduced to many other tools. And you can see that even I'm doing some training for the frontline workers in the community. They were using chatbots, they are using ChatGPT, they are using Gemini. I got really shocked and see that, like, they are all nurses, and they are seeing that this works. Because how you came to know about it, because we are using for homeworks of our class homeworks of our school kids. This is happening, like, so I'm what I'm trying to say here is that, like, try to understand the person who is going to use that and observe them and simulate that if you are going to be that particular person, how that will be helpful. So that's what I would say a technologist should necessarily have the skills other than their technology skills.
Yeah, I agree. And I love the 2040.
For
I just
anybody
love
who's not reading the
comment.
chat, Prantar
Yeah.
says, we suffer from 2040 syndrome. Decisions taken at meeting rooms at 20 degrees Celsius, but have to be implemented in the field at 40 degrees Celsius. I've never heard anyone say that before, and it's brilliant.
That's really
Go
brilliant.
ahead,
Yeah,
Dr.
I
Prabhdeep.
completely agree. No, so I was just saying that that's so true because I think there is that disconnect. And once we bridge that disconnect, I think a lot of problems can be solved. And I think there's a question, very important question on the cost. And I really want to come to that funding limitations. So when you say diverse team, yes, we do understand there need to be diverse team. There need to be programmers, designers, and now also people like who are able to make the data more understandable, visualization, so on, and many other things, and maybe now adding AI as well as an important component in these teams. What happens usually is that, so core of the projects is generally health, right? And tech is one, as Dr. Ganesh already said, that we have 6 pillars of health system, and of that one is information system, another is technology, another is HR. So let's say if you have a public health project, the funding has to go to everything, and then there is some funding left for tech, and that's never enough. So I think that's really a problem. I don't know what the solutions are, but I think really better collaborations. I mean, that's where hard problems exist, right? So we need more volunteers, and people could pitch in small parts, and that will go in a big way. So where they think their expertise is, how they can sort of do that. Let's
To
say that.
interrupt you for a second, you just said volunteers. But I know in some of the projects you're working on, people are getting paid, right?
Yeah,
Where
of
does the
course.
money come from?
So basically, nowadays, all the large public health projects, which include some sort of a large either data collection or a back-end dashboard or whatever you call it, do have funding for technology. And this funding comes from governments, from large donors, from the multilateral banks, then also private donors, as well as from the large international NGOs and UN as well. So all these organizations fund tech as part of the public health projects, and they actually employ people full time. And this is like a full time job. But what I meant was that quite often the teams we get with all that funding may not be as diverse as we would like it to be. Means that you may not have people with all kinds of skills, or there might be some sort of an imbalance in that sense. That's what I
Yeah.
meant. And adding value by sort of making the team more diverse and diverse set of skills would possibly improve the technology, but quite often due to financial constraints, it may not be possible to make it
Yeah.
happen. What I
We're
meant.
kind of getting to the sharp end of the question here, right? Like there's a John B just asked in the chat, can public health ever be as attractive as corporates for best technologists? I used to work at Google. I took an enormous pay cut to work in public health. But I'm lucky I could afford to do that. I don't know if public health can ever compete with the Googles of the world. Google makes a ton of money by, selling data and ads. But do you think public health projects can compete in other ways to get great talent?
Can I add a point to that? In terms of my
Yes, please.
experience working in public health, I think even in today's chat, Dr. Ganesh and Dr. Prabhdeep spoke about observation and speaking to users and going to the field quite a few times. And I know on the other hand, in the corporate world, we struggle to make space for excellent user research or excellent, embedding ourselves in the user's environment the way you're describing. So one thing especially is like the user is, I was speaking to a friend recently and we were discussing how user is a hill that you can die upon. when it comes to public health, right? And along those lines, there are so many other, in terms of scale as well, to be able to see the your work, even a small change being put out and creating ripples of change for so many patients. I think those are benefits, so to say, of public health. But I just wanted to get the ball rolling on that, and would love to hear what Dr. Prabdeep, you and Dr. Ganesh have to say as well.
Shall I go over? Yeah. So the comparison here is tech world versus real world. That's why the question I'm seeing here, like tech world, of course, high paying job. There is no doubt about it. The public health world, no, not at all. Tech world, you can do things quick to see some change happen. Public health world, it's pretty slow, okay, and dragging. It's not motivating, okay. The third important thing which I say is that in tech world, the outcomes are in terms of money, okay. Economics works like that. Like if you develop a great product in tech world, it brings you a great fortune. Whereas in public health, the outcomes are not at all economics or not at all money. The outcomes takes a lot of time, even though a very great technology is there. Even when we see it saves lives, it's not much evident. It's a slowly happens, and it's not like a sudden peak. Whereas you can see a sudden peak in your salary, you can see a sudden peak in the company's business, you can see a sudden peak in the working environment for a technologist in a tech world is entirely different. Whereas, please come to government hospitals and see that. And if you stay there for an hour, and then you can understand that, like how actually things work out. Dr. Prabhupada, yeah.
Yeah. No, I think it's really about where you are in the, I think that Maslow's hierarchy. I mean, I'm sure all of you are aware. I mean, it depends what your professional goals are, but I think we all reach a point in our career where we want to make a difference. I think it's a very inherent human instinct or drive. It's just that it may happen to different people at different time points in their lives. And if you want to make an impact, you have to look at areas where you can make an impact, and public health is one of that. And it's not the only one. There are many areas you can make an impact. There are climate change, education, and so many. But I think public health is one such domain where you can really see that what you do is going to impact millions of lives. And it's about the change that you bring, and the change you bring is not one for one person at a time. You are actually at one stroke changing lives of millions of people. Like you all can think of, imagine if we did not have COVID vaccine, right? We had a system in place, and there are millions of healthcare workers who didn't even think about whether they are going to be alive, but they went to field and they vaccinated people. Why they did that, right? So there were doctors who went to work every day. My husband, he was a practicing clinician. He went into the hospital and saw patients with COVID every day. So I think we were in the field. So what I'm trying to say is that uh, there is something bigger than us that drives us. And I do understand there has to be a balance of what is financially viable for your career versus what gives you that very deep satisfaction, and you need to find that right balance. But I do feel that even if you don't want to look at public health as a full-time career for whole of your life, you could do sabbaticals, you could look at project-based engagement, you could say that I would put X% of time. You could look for organizations which will be able to engage you at a reasonable salary. It may not be as good as maybe which big tech can pay, but reasonably decent salaries. And I think it's also that I know many people who have been from the tech side, and at some point in their career they have just found it very gratifying to make a transition to more socially oriented ventures. So it's really a matter of prioritizing what's important for you. I don't think everybody can do it, but maybe you can do it at some point of your career and for some period of time. And one thing I can promise you, you will never regret it. No one has ever regretted being in public health. I can promise you that.
It is quite intoxicating that way. Dr. Prabhdeep, a question
It's like
along those
addictive.
lines.
It's
It
addictive.
is.
That's what I meant. You do, and then you want to do more. Yeah. Yes.
Yeah, yeah. So you said that, you were talking about being able to make change at a large scale in this role, and that being the driving force. So one can argue that there are other disciplines, like, let's say, you get involved in public policy, or epidemiologists, as yourself, right? Who arguably have more influence when it comes to making change at scale than a technologist. So two questions on that front. A, is that true? Is it really that we don't have as much influence? And if it is true, then why should technologists still care about the space?
Okay. So, if I understood this in terms of, do epidemiologists or the technocrats has a role in decision of what technology to be adopted? Uh, Answer is no. So they do have a kind of like an they say role in terms of increasing the usage of it, but the decision of development, sometimes in some other situations we have seen, very rarely this happens. I cannot say it's partial no. Many situations, I mean, we have seen, but not every other time, that these technocrats were taking decisions in order to develop some technology solutions, part of it. But who does it? So the in terms of health system or in terms of public health, majority of the decisions are taken by program managers and policymakers. So they just decide that they want to, like, this is what the app should look like, and they want that to happen. That's it. Okay. Sometimes if it works, fantastic, because it goes at scale immediately. And if the alignment, these three people align: the policymaker, program manager, the epidemiologist, the person who is going to implement on the ground, and the healthcare worker who is going to use it. If everyone aligns, even a few percentage of it, not 100% of it, even less than 50, is around some 40 to 50, closer towards that. Even if it aligns, these are arbitrary. I'm not saying with any kind of fact, but if it aligns, then it's a great success. So that's what I see. So they do have a role in terms of making it work on the ground. Yeah,
Yeah.
Dr. Prabhdeep, yeah.
I think there is a question very related in the chat box. I think I'll maybe just bring that along. So, what does success look like? So, I think the success, the product success for a technologist, what it looks like. I think if your users are taking it up without they being forced to use it, that's what success looks like. And we have actually seen it. There are products which people are just happy to use. So if they see a value, they have to see value. I can tell you, like, many ways they can see value. One, it's making their job easier. It's saving their time. It's making it easier for them to track patients, or reach out to the communities, or reach out to whichever the target group. Somebody may be working with mothers, somebody may be working with TB patients, somebody may be working with let's say hypertension patients. So there are a lot of these interactions that take place between the healthcare provider and the community or the patients, and any kind of technologies which make that more effective or better or easier, and hence are being adopted by people. That's what success looks like. And I think also, most importantly, where you have less effort to scale. So for example, if you have done the training for 500 people, and then with minimal effort you can go from 500 to 5,000, so that's a success. So those are the kind of products we are really looking for, and hoping that all the brilliant minds out there, and I know, like, the capacity is out there to build such products. We just need to get the right teams aligned to make it happen.
I really like John B's question, which is the flip side of this, in the chat. why do products fail? We've seen a lot, my experience in public health, often the biggest competition to technology is paper. Paper works great. It never runs out of batteries. It's easy to use. I can receive minimal training and do my work. It's very flexible, right? So oftentimes you introduce a technology and people fall back onto whatever they were using before, usually paper. Um, what Why do technologies fail? Why do most technologies fail?
Yeah, I think I agree with you. We have been used to paper-based systems, and most of us believe, most of us in the medical, the public health sector, is that we feel it's working for us. So the point is, what is that technology is going to give us that paper cannot do, right? That's where the problem comes. Most often what happens is, when a solution is given, some, let's say, it will say it will do this but will not do that, it will or I can't open when I want, or something like that, right? Some practical problem is there. So what happens is, quite often the doctor or the nurse or the healthcare workers have to do both. They have to do the paper based records and they have to do the digital, which only adds to their work. So they don't see value why they should be using the digital solution. So I think it's important to keep in mind, when you're designing the solution, what paper is doing for them, right? And will you be really able to replace those tasks which are currently being done by paper? And I'll give you the commonest example is really tracking people, right? So quite often, whether it's vaccination, whether it is people with diabetes, hypertension, we need to track them, right? So for example, if you say that, okay, this tech, you'll be able to record a visit, but I can't give you a list of people whom you need to call back, or whom you need, let's say the children who are unimmunized and you need to go back to them, and how easily I can access that information, right? So I'm used to doing, I think those of you who might have your kids immunized, like in India, we give a card for every child, right? So, and a card is kept by the healthcare worker. And so healthcare worker is just so comfortable. They know which kid came. So they keep segregating who came, who didn't come. And then end of it, they have some cards of those kids who didn't come. And they can go back to them. So can tech do that task for them? So if it is as simple as that, then people will be happy to take it. But most of the time, at least in my experience, I have seen that tech doesn't replace the paper. It actually means they have to do both. And that's where the problem comes. Yeah.
Yeah, I have
Just
a
adding,
question for the. Yes, yes, please,
yeah,
please, please
please.
go, please.
Please go ahead. Yeah.
Yes, I have a question for Prabdeep, ma'am. Ma'am, someone like me being a very young professional in field of public health, what are the potential areas in which public health is like an umbrella? So which areas need a technological transformation, considering the upcoming trends which are changing, and we are in 2025.
Yeah, I think primary care, I would say that's where we need the digital transformation, because as you see, that's where we need action, right? We need more prevention. So as we put these complicated electronic health record and systems like that in bigger hospitals, and now you see with the AI coming in, there's so much of advanced tech coming in the imaging and all. But when you see where it is all deployed, it's all in the hospitals, it's all in the bigger cities, it's in the tertiary care. And when you really look at, like, what are the solutions you have for primary care, there are very few solutions which work for primary care, and that really needs to be the priority. We need to see how is it that a nurse or a healthcare worker or a doctor sitting any part of the country, world rather, I would say, able to easily get the information, let's say get the symptoms or whatever be the information about the patient, use nowadays with AI, maybe I use AI tools to actually do the triaging, find out, what are the best options, and then offer solutions. And if it's a nurse, can she quickly connect then with the doctor and actually offer the solution on the spot, rather than telling the patient you have to go, you have to travel 100 kilometers, right? So we really need tech which will work to bridge the gap between the what you can say the high tech technologies are versus what what most people need. And most people don't need those high-tech technologies. They need very simple solutions. Yeah.
Just in connecting both the thing, I just wanted to mention the point what Dr. Prabhdeep was telling. The immunization card, where a mother carries, the purpose is what? It should inform the mother that what are the vaccines were administered for her child. And it should inform the further purpose is that when she carries to the healthcare worker, any person across the country, it will tell that these are all the vaccines which has been administered to that particular child and what is pending, and for that particular child of that particular age, whether the child is fully immunized or not. This is the connecting the purpose with this. When I come to this digital example, recently I have seen the same paper, but in a different form. What they are using is that the doctor is having a pediatrician has having a business account of WhatsApp, and to each and every patient, he takes the picture of what are the vaccines done, post as a picture. And when he posts the picture, then that is like an authentication from his side. These are the vaccines done. And you know what he does? Next visit, he writes a date and tell that these are the following vaccines. He types that, okay, and send it as a message. And that gives a kind of like a notion. So they go back and see that, oh, these are the people who are supposed to be vaccinated, and they have vaccinated, and these are the pending vaccines for that. Each and every time, he will reduce for one by one vaccine. The same message, copy paste, remove that vaccine, then a different date. That particular message, when he posted, carries the date stamp and time stamp, and that clearly says that when that vaccine got administered. This I got mind blowing, like how they were using it on the ground. Uh, the problem with the paper is that the paper increases the usage, but the paper may not communicate the information what it is supposed to happen. But it will increase the usage, and that information lies with that particular user. That's one biggest downside where I see in terms of paper. It requires some more additional skill in order to tally that and send it back to someone who really needs that particular information of that. So all these things are pointing towards one part of it is that like what makes the technologies more successful here is that I take the same example from one in comparison with WhatsApp, Skype, Messenger, or GChat, Hangouts, whatever it was there. But Skype had every other thing, all the features what currently the WhatsApp is currently having. But WhatsApp introduced with a small thing is only messaging. But Skype didn't exist in market, and but WhatsApp is now currently is in the market now. Now this is just an example. I always getting astonished that like what makes a success is that usage makes a success, and sustaining that usage is the most important indicator of the success.
There's another good question in the chat about kind of the trend in public health. It feels like over the last decade, digital projects have gone from pretty basic to getting more and more adoption. Do you think it's related to a younger workforce coming in that's more used to digital tools? And do you see that trend accelerating?
Actually, that's a very interesting question, and I'll start, but I think Mahima can answer that. So Mahima was recently working with us on a project where she made a very interesting observation on the age and tech adoption, and I'll not talk about that. I think she will tell that. But I feel automatically it will not happen. Just because younger people come in, then you think that the tech will work in health. No, I'm sorry to say it will not. You have to make sure that these solutions are really tailored to what the needs are. And I think earlier I saw in the chat, I started my conversation with EHR, and someone had written that this has been a problem for 50 years. Like, even today, if you ask most doctors in the hospital, they're using EHR because they are forced to use EHR. They don't like to use EHR. I don't know why it is like that, but it's been really very not a very positive history of how EHR adoption has been done in the health sector. So when I look at public health, I don't think the adoption will be natural just because there are people who are a little bit more comfortable with tech. It has to fit in. that's where the whole problem is. You may know tech, but if you're sitting in a clinic with 100 patients standing there, uh, what will you be worried about? You will not be worried about tech. You'll be worried about, how I make sure I complete my work in time. How do I manage the crowd? How do I manage the people's anger? Because it's taking long time. Let's say I have a laptop, I know to use it well, but should I do this or should I look at the patient? So I think the challenges will not just go away. I mean, just because we close our eyes, challenges will not go away. And we must understand that globally, I'm not only talking about India, but in most low middle income countries, we are understaffed. We do not have adequate human resources, especially when you get to the ground level. So if the solutions are going to take a lot of time for the whoever is a healthcare provider, they are not likely to use it, irrespective of how tech savvy they are. But I really would like Mahima to mention her experience on the ground. Yeah.
Sure. Yeah. I think it's not, I think on the face of it, it seems like having younger workforce equates to a higher tech adoption. But what what I think one does not see is that there is, let's take the case of an ASHA worker, right? There are younger ASHA workers and older ASHA workers. Even though a younger ASHA worker might be able to use your app, it's the older ASHA worker who can convince a patient that they need to be screened or they need to get their BP taken, right? Because care is trust built over years. And in a community, it's you work very closely with, if you've been an ASHA worker for 10 years, people listen to you. And um, that is what sometimes advances care, or that is what gets patients to come forward for screening, because they have that built trust with the healthcare worker, not necessarily because they can use your technology. So yeah, it's not a very straightforward answer.
Uh, shall I pitch in? Uh, the discussion here is that it's because of the younger workforce that where we started using a lot of digital. I'm borrowing the example from the other world, like OTTs. Okay, so if you see that, like many of my family, and I am also seeing that many of the older age females, males, they are watching their TV serials and web series in the mobile only. How they get adopted towards that? They were not used to it. And why? Because it solves a problem. Most important problem is that they need to sit before the TV in order to watch that particular series or that serial on that particular time, which is telecasted on a television channel. But they don't have time for that. What they will do, they pile up all those things and see all the episodes at one point of time. The problem is that that mobility, it solved that problem, and that makes it. Age, I don't think so. Many of the workers who are there, say like the vendors, they are all older age. They are using Google Pay. They are using QR code services on Paytm. They have been using all these kind of like all these universal payment interface in India. It's just all digital payments. Digital payments became very popular, and all these vendors are all not related technologically trained. They know what the problem is, that here technology solves their problem, and that's why they are using it. So what is the problem which is going to it solves it? Age may not be, but it looks like that, but it may not be. Okay.
Yeah, I agree. I think if we can
Yeah.
make the tech user friendly, I think across the age groups we will have adoption. And I mean, just on the lighter side, it's actually our elderly who are using, at least in my house, it's my parents, my mother-in-law who actually use more tech than me, in the sense they know about all the apps and they really extensively use tech. And I think if in India, at least if you are on WhatsApp groups, you will see people who write more on WhatsApp. Actually, they're older people. So I think people like to use tech. That's my take. I mean, if they understand and if it's not too complicated for them, they actually want to use it. Yeah,
Yeah.
that's a
Yeah. And if I
positive
can
side.
add,
Yes.
yes, and if I can add, tech also is quite aspirational for some of the workers who are in the older, age category, because it makes you feel new age. It's you're now using newer technologies, and it makes you feel like we saw and feel that people go through a lot of effort to actually learn technology because they want to integrate that into their work. Because it makes them seem more cool, if I may say so.
Mhm.
So
There's a
to
question,
kind of
important question on security. I think Daniel can talk more about that. But what I want to mention was that I think that is really important. And as we build tech solutions, we also need to step up our capacity to safely keep the data, safely sort of make sure wherever the data is kept is safe. And I just wanted to mention that at least we work a lot with governments, and I think there's increasing recognition of that. And several policy frameworks and tools have been sort of brought in to actually make sure that the patient data is safe. But it's definitely important. I just wanted to call it out because someone had mentioned, and really important. Yeah.
So leading into the last 10 minutes or so of the conversation, I really like there's a question from both Shivani and Magana, both asked in the chat. They've got a background in design or a background in user research. And as you said, Dr. Prabhdeep, about halfway through the conversation, you don't you can get involved in things like taking a sabbatical, you can get involved in a project for a year or two and get a taste for it, but how do you get your foot in the door? Like, it feels a lot like the opportunities aren't just sitting there on easy to see job boards. If I'm a young designer or even an experienced designer in India or elsewhere, where should I be looking? Like, how do I get my foot in the door?
Ganesh, you want to go at it, or you want me to?
Yeah, fine. Like, so one thing is that like I don't know. I'm seeing the chat that they don't like the word volunteering. I do agree on that particular part of it. Volunteering doesn't mean it's like a full-time part of that. Like some time of, say, in some of the weekends that you could spare, or some of the days in the week. The best part is that like understand the industry much better. That's what the technology world says it, and how to do about it and how to work on that. Like, and there are public health organizations who are actually working closely with the communities. You can identify, have conversations with them, and get into that. These people are quite active on social media, on posting about what are the problems they are dealing with. They can be easily identified. It starts from your own place, like whichever the city you are there. Public health problems exist everywhere, and you can start working on it. And second is that like, and definitely some of the communities who are closely working with the systems and to solve the problem are now getting emerged. I'm seeing that, and they could work with those kind of communities on that. Nothing assured, but welcome to the world of challenge is what I could say. A challenge starts from us, and it goes to the public health world. I mean, the community, and as well as the transition of it. Everywhere it exists. Dr. Prabhdeep?
Yeah, I think there are, so those who are looking for opportunity, there are, I think, a couple of ways you can go about it. So one, I agree with the problem because, we actually don't put it out there. Let's agree with that, Ganesh. We don't put it out there. Like people who work in public health don't put it out there. Okay, these are the problems we are working on. I think that's a problem on our end. I agree with that. So we need to have a better interface, and I think that's the whole idea Hard Problems is trying to address. That can there be a platform to actually bring these people together? Like I would never have met Daniel or Mahima if we were part of a project that we worked together. So we really need better platforms to bring people together. But yeah, as that continues to happen, meantime, what you can look for is, so there are certain universities, there are academia, there are medical schools, there are research organizations which are working on public health problems. You can reach out to those people. Now, I think through LinkedIn, you can find people who are working on these projects. There are international NGOs, there are UN organizations, and now there are several companies. And then there are Section 8 companies. India also has what we call as non-profit companies, and there are quite a few of them working on public health problems, and they're constantly looking for talent. And somebody said user research. Yes, we really need more of that, and it's always welcome. In any digital tech that's being developed, we need a lot of user research. So reaching out to these people who are working in this area might help you understand, how much time. What I meant by volunteering doesn't mean that you have to sort of work totally without getting paid. What I meant was that you could look at, let's say you want to do a project, you want to put 20% time, or you feel that, you're taking a break and you want to do something which is kind of satisfying for you. So you can look at those kind of opportunities as well. And I do know there are many people who are not working full time on public health projects, but they work with someone who is working full time, and they define their role, and they actually do that part of it. So I think, I'm sure there will be opportunities if you really look out. And I think we have this responsibility after this conversation. Now I'm thinking loud, that we actually need to encourage those who are working on the health side to put it out there and make it more visible to those who want to contribute.
Yeah, there's a really good
And if I-
observation from Dr. Prantar in the chat, where they say that, as a physician, they got their foot in the door by there's maybe you could describe the story yourself. I see you're on video there. Do you want to come off mute?
Yeah. So I want to tell all those. So by training, I'm a super specialist. Okay. So hematology. But the problem is that in a super specialty, we still have maximum number of patients with iron deficiency anemia, which should not have been there in my country after so many years of independence. So while I was thinking on the other way, and I was also thinking, how do I get a foot in the door and trying to experiment with electronic medical records and all those things. So I just sent an email to the CEO of a technology company that you are doing so much innovations in the technology world, but healthcare needs it more. But I was fortunate that he responded to that email and he told me, you start working with us, you tell us what to do, and we can collaborate. So if you really want to do something, the universe will conspire to help you. I can assure all of those who have that question in mind.
It's very, very inspiring.
Yeah, it's inspiring, but the universe might conspire, but it especially conspires for people who put their their hat in the ring and offer to work on something. And I think the marketplace right now for technologists to work in public health, especially designers and user researchers, is very immature. And so oftentimes right now it does take reaching out to somebody you admire, reaching out to a project you admire, describing how you could help them, not just saying, hey, I'm interested, but saying, hey, this is the type of work I'm really interested in doing. This is probably what I could offer to you. Maybe we could try it as a week or two of volunteer work. And if you see the value in it, we could turn this into a bigger project, not volunteering for, your whole life. But going in and showing some value is a good way to dip your toe in the water and potentially get your foot in the door, to mix some metaphors. Dr. Prabhdeep?
Yeah, no, just wanted to point. I think there is a matter of understanding the language and trust. So you need a little bit of rapport, because quite often, I've been part of these meetings, and when you sit and we are talking something, and then people from the tech side are talking something, and sometimes there's no sort of clarity of what we are talking, right? So what that leads to is sort of a disappointment on the part of people in public health, that they are not understanding what we want, and the technologists feel like they're just not getting it, what they can do or what they cannot do. So I think that's where the crux of the problem is. So initial part of, I think if you're like early into public health kind of work, I would say you need to spend time just understanding your stakeholders, like people you're going to be working with. So once you get that right, you will definitely be able to understand like where you fit in and what you offer. And I'll be very honest, most of the people in public health actually don't know what you can offer. So unless you tell, so don't take it for granted that, I've given my CV and so they should know what I can do. No, I don't know what you can do. So I don't know the difference between, for example, I mean, now I'm a little better because I work with a lot of tech people. So I know, like, okay, there's a mobile app design, and then there is backend engineering, then there is a dashboard, then there's a user research. See, all this language, don't expect people to know. I mean, I'm sure
And we
this,
feel
now
the
there
same way
are
about
AI
public
researchers.
health.
Yeah.
I still
And
can
then
barely describe to you what a program officer does.
so these are and now there are, I mean, I also work with AI researchers, right? And then within that there are people who will build the model and then optimize and then you deploy. And so you please understand, like, we don't know all of this, we don't know the language. So I think getting that right is really the important first step. And once you get that right, then I'm sure you will really enjoy, working on those complex problems which make a big difference.
I think we're right at the end of this. I think there's one, good question here. Dev has, set us up with a big, meaty, difficult question, which you guys have decades of experience between you in public health. Where is it all going? What are you excited about? In the next decade.
And to that, can I add one more question, which is that Dr. Prabhdeep, you're designing a new master's in public health and a PhD in public health program at IISc. So along those lines, right? When we're looking into the future, what kind of leaders are you hoping to shape?
I think I'll answer the second one. That's an easier one than the first one. So I think what we have now realized is we do not have enough trained workforce in India which has interdisciplinary public health expertise. Like where people like me and Ganesh who are trained from the medical side, and then there are people who are trained in the tech side. But what we really would like is a new generation of professionals who are able to understand this language. So we don't have this confusion on what you're talking, what I'm talking. That's the goal of our new programs which we are developing. So we are trying to see that how we can have an engineer, a doctor, and let's say a design researcher in a same classroom and talking about the same problem and understanding each other's language. I think that's the vision. It seems hard because when we actually start looking at how we build a curriculum that can cater to such diverse audience, it seems really a very tough task. But I think it's doable, and slowly we will figure it out. And those of you who want to help, you're most welcome to contact me for that. Now, coming back to the first question on what's the way forward in public health, I think it's very positive. That's the way I look at it. I think you all must have seen that longevity, right? The life expectancy has increased. It continues to increase, right? So that's a positive side. People used to die early. People used to die of very preventable diseases, like vaccine preventable diseases, what we call as like, there were diseases which, and then you have seen there was disability like polio, and we are also making huge progress in things like TB, right? There were a lot more people dying of TB earlier, and we are hoping that that will not happen. When you look at this whole scenario, it's positive that people are living longer and are healthier. But the negative side is that we also have, very big burden of chronic disease. So when you live long, and if you don't have a healthy lifestyle and combination of your genetic, lifestyle, and factor, you also get what we call as chronic disease or non-communicable diseases, which are actually a huge burden for the health system. So looking at it from a tech perspective, in fact, a lot of interventions that we need to do are preventive in nature. So unlike earlier days, a lot of things patient can do themselves, community can do themselves, or nurses or healthcare workers can actually sort of build capacity of community to do things like, how to eat healthy, how to stay active, how to get yourself checked, preventive health checkup, and so on. So what I see going forward is there will be a lot more opportunities for the digital technologies to actually promote positive health, I would say. Like, we shouldn't be looking at the disease. We should actually be looking at being healthy and what we call as a healthy lifespan, how we expand the healthy lifespan, not just make sure that people live longer, but those extra years which we are adding on are actually healthier years. And I really feel that a lot of innovation is going to come in that space. And we will be able to make a huge difference if we are able to get right kind of technologies in the hands of people and also in the hands of healthcare providers.
Fantastic. I think we're towards the end of our time, but if I can just take a couple of minutes on some closing thoughts. So, on the conversation about how to work on problems that are related to public health, please do join our newsletter. I'm especially excited about the next one because we have identified a few roles in public health, and we'll be adding them to the newsletter, so you can take a look at that. It spans across engineering, it spans across design and product management, and we hope to surface more such roles, while also, of course, working with people like Dr. Prabhdeep and Dr. Ganesh to make some of these roles as well. But other than that, what's next is Dr. Prabhdeep, maybe I think you can talk about the short course by IISc on digital health.
Yeah,
that we're
I
designing.
would say that watch out for details, but we are currently trying to design a course where we would like to bring these diverse kind of stakeholders together, where the talk doesn't begin with the tech, but it begins with the problem solving, and then how the technology comes in to solve those problems. And I think we are really at the sort of stage of brainstorming and putting together what might work for such a diverse audience. But do look out, and we will put it out there in, I think, 2 to 3 months.